In the name of God, in this part we are discussing the second layer or the middle layer of the adrenal, the hormones of this layer. The total name or the total name of these hormones, we call them as glucocorticoids. The gluco refers from glucose. It means that these hormones can control the level of glucose in the blood circulation. And corticoid means that they are derived from cholesterol. In the first slide, you see the structure of all the hormones from the adrenal. The first layer, aldosterone, the second layer, cortisol, and the final or the third layer is androstenedione. All of them are very look-like and similar to the cholesterol because they are all of them are derived from cholesterol. And also, there is some similarity in the shape of the aldosterone and cortisol. And sometimes the receptor for aldosterone mistake cortisol and they instead of the aldosterone. So some effects of cortisol is mimicked to the aldosterone. Okay, cortisol has three different effects on the body. At first, it's the anti-stress hormone in the body. We have the stress axis from started from the hypothalamus. In the hypothalamus, we have the CRH that during stress it will be released, and its influence on the corticotrope cells on pituitary. And after that, the pituitary during the stress, it will release ACTH, and the receptor for ACTH is located in the middle zone of adrenal, and it's causes it to produce cortisol. There is a negative feedback between cortisol and ACTH or CRH. So this is the anti-stress cortisol because it wants to relieve the body from the stress effect, the bad stress effect. But what is the stressors for body? The stressors can be physically or even mentally. Trauma, any infection, even intense heat and cold can be regarded as stressors. The injection of norepinephrine to the animals, any surgery, and even restrain the animal or even the human body. If you keep a human in a very small cell, it can be regarded as the stressor. And also, and finally, any disease can be regarded as a stressor for the body. So during all these stressors and after all these stressors, what is the reaction of the body? It creates cortisol to defeat body against these stressors. In this slide, you see that after breaking the bone of the mouse, what will happen? The corticosterone in the plasma and its secretion from the adrenal will be increased immediately after breaking and because of the pain and some damage to the tissue. But the second role of cortisol is that it's a metabolic hormone in the body. Previously, we were discussing that some hormones has the metabolic effect. What does it mean? It means that they can control the level of carbohydrate, proteins, and fat in the blood circulation. So, one of the metabolic hormones in the body is cortisol. What is its effect on carbohydrate? It wants to increase the level of glucose from different ways in the blood circulation. For example, it increases the gluconeogenesis. What is the gluconeogenesis? It means that it induces liver to produce more and more glucose from amino acids. What is the source of these amino acids? The source is from the breaking the collagen in the muscle. So by atrophy muscles, it will cortisol can increase the level of amino acid in the blood, and these amino acids, after entering liver, they can produce glucose. The other way for producing glucose is decreasing glycolysis because under the control of cortisol, The glucose doesn't want to enter the cells and go to the process of glycolysis. So the level of glucose will be increased. The other thing is it just break or lyses the glycogenolysis or the glycogen lysis in the liver is the other source of increasing the blood glucose. But how about the proteins? Cortisol is the main protein for increasing the catabolism of protein, for breaking the collagen and deteriorating the collagen not only in the skin but also and specifically in the muscles. So the amino acid, the free amino acid in the plasma will be increased. How about the fat? It increases the free fatty acids in the plasma, but because it increased the appetite. Some parts, the lipid in some parts of the body, for example, the hands and the muscles, the hands and the feet, the proteins will be, the lipid will be lysis, but we will have the accumulation of lipid in some parts, for example, in the face and in the upper part, in the trunk and the upper part of the body. And because of that, some obesity, specifically in the fats, the fats in the stomach and this area, fatty bile, we will have a fatty bile in these persons. The second role, the third role of the cortisol is its anti-inflammatory effect, which is very important for pharmacy and pharmacy. Why it has some anti-inflammatory effect? Because at first, the first and the most important thing is by stabilizing the membrane of lysosome. Normally, the inflammation and the effect and the signs of inflammation will be started because the membrane of the lysosome will be ruptured, and after rupture, some factors which can um, create, for example, the some leaky membrane in the, especially in the endothelial of the vessels will be appeared, and because of that, some edema and some redness and the heat will be produced in the organ of the after inflammation. All of them will be ceased after cortisol. The second role of anti-inflammatory effect of cortisol is by decreasing the vessel permeability. During inflammation, the vessel will be permeable. So, and because of that, some proteins will be leaked from the blood vessels to the tissue, and because of this leakage, what will happen? The edema will be appeared in the tissue. All of them will be seized by using cortisol. The third effect is decreasing the leukocyte infiltration. If the cause, we know that two of the leukocytes, one is monocytes, the second is neutrophil, can be infiltrated or immigrate from the vessel to the tissue, to the damaged tissue. Their role is phagocyting. So by phagocyting the pathogen or even the dead cells, they will clear the infiltrated area, the inflamed area. And this will be seized for after cortisol. And also the phagocytic role of the neutrophil and macrophages will be decreased under the control of cortisol. Not only the macrophages and neutrophil, the phagocytic role of them will be decreased, but also cortisol will decrease the immune system activity. For example, the activity of lymphocytes T and B, both of them will be ceased. And because it stopped the secretion of some inflammatory cytokine like interleukin 1, which is the source of the fever, creating fever in the body. It will be stopped. The secretion of this interleukin will be stopped, and because of that, cortisol has some anti-fever effect. But there is a question: Is it good for a person with inflammation to use, for all persons with inflammation to use cortisol? No, it depends on the source of the inflammation. Many diseases, even for example, the stroke, or heart ischemia. During heart ischemia, the damaged cells will produce some cytokines, inflammatory cytokines, which can um, which can make the situation worse. So if there is no pathogen and the inflammation is because other sources of, pathogen, it will be okay. So it's a good choice to use cortisol. But if we have the source of the inflammation is a pathogen, a virus or a bacteria, this is not only good, but also makes it, this is the worst thing to use cortisol, because the pathogen will remain in the tissue silence for a while. And after a while, the leukocytes, the phagocyte of the neutrophil and macrophages will be seized. The immune system are very weak after using cortisol, so the pathogen after a while can continue its effects in a bad way, because the immune system of the body, there is no immune system of the body under cortisol. So if the source of inflammation is because of a pathogen, it's forbidden to use cortisol. Okay, in this slide, we see the different signs, the heat, redness, swelling, and pain of all of the signs of inflammation. And the second, we see the immigration of leukocytes. We see how a neutrophil or monocyte can immigrate to the inflamed tissue. At first, when it's close, because normally monocytes and neutrophils are traveling in the middle of the vessel, and when it's close to the source of the inflammation, it must be close to the endothelial cells of the vessels, but it will be appear by appearing some proteins, not only in the leukocytes but also on the endothelial. We call these proteins selectins. So different selectins that can be attached to each other will be appeared, but the attachment is not very tight, and the neutrophil or monocyte can be rolled on the endothelial cells. But when it's appearing the center of the inflammation, it must be stopped, because at this time the selectins will be disappeared, and another proteins, the integrins, will be appeared. The connection of integrins are very tight, and after that a chemokine, interleukin 8, which is a kind of inflammatory cytokine, will be produced by damaged cells. It will uh, guide the monocyte or neutrophil from outside of the vessel to the inside of the tissue, to the damaged tissue. This is the immigration parts of the leukocytes. All of the producing of these proteins will be stopped under the control of cortisol. Phospholipase A2. So this is not good for the body, because not only it prevents the production of inflammatory prostaglandins, but also it prevents the production of good and physiological prostaglandins. The other effects of cortisol is also anti-allergic reaction. It has some effect on blood cells, because it decreased the eosinophils, it atrophied the lymphoid tissues, it increased the red blood cells. During pregnancy, it's very important. Cortisol has a very important role during pregnancy, specifically during the third and 32 weeks of the pregnancy, because during these weeks, the adrenal of the fetus must create enough cortisol, which is which mostly exist for lung surfactant production, which promotes the maturation of lungs. So it's very important. Cortisol has the receptors in the hippocampus, the source of the memory, and at this part, it's working with epinephrine. But we are going to see the anti-allergic effect of the cortisol. In the next slide, we see a mast cell. Inside the mast cell, we have some vesicles or granules of histamine, and we know that by rupture of these granules and releasing the histamine, what will happen? The reaction of the allergic reaction will be appear. But an allergen must be entered the cell, and the antibody for the allergen must be created in the body after attaching the IgE to the mast cell, and by attaching the allergen to the IgE, the granule of histamine will be ruptured and the histamine will be released. But what is the anti-allergic effect of cortisol? Cortisol cannot reduce the production of IgE. It cannot reduce the attaching of allergen to IgE, but it can stabilize or make tight the cell surface of the mast cell granules containing histamine, and because of that, the rupture and release of histamine will not be appear when you are using cortisol. Like any other hormones which is under the control of hypothalamus and hypophysis axis, cortisol has some fluctuation during 24 hours of the day. The highest level of the cortisol is in the early of morning, for example, 8 o'clock of the morning. But when we are going to the midnight, it will decrease. So when we are close to the midnight, we have the lowest level of the cortisol in the blood circulation. Because of that, the inflammatory, when we got, for example, flu, our signs, the fever, everything will be appear just during night. But early in the morning, everything will be stopped, and because of that, we feel better. It's because of the high level of cortisol and its anti-inflammatory and anti-fever effect of the cortisol. Okay, we say I was talking about the axis of hypothalamus and the pituitary. From the hypothalamus, the CRH will be released during a stress or any other effect, and it promotes corticotrope cells in the hypophysis to create a very big protein, POMC. So at first, corticotrope in the hypophysis will not produce ACTH, but it produces a very big protein. We call it POMC. POMC is the abbreviation for pro-opiomelanocortin protein. So it means that this big protein contains some part which is the opioid system. This is the beta endorphin, and melanocortin. This is they are alpha MSH, beta MSH, and gamma MSH, and also corticotrope, which is ACTH. We have two different enzymes that they just cut it in from different sites. One of these enzymes, which is in the red red color in this figure, is PC1. PC1 is acting in the hypophysis, but the other blue one, PC2, is working on hypothalamus. So in the area of hypophysis, the PC1 cutting it to what will create ACTH, joining protein, N-terminal, and beta lipoprotein. And as these proteins can enter and go into the hypothalamus, can enter the blood circulation and go to the hypothalamus. And there, PC2 is existing and cutting it into gamma MSH, alpha MSH, beta endorphin, gamma lipotropin. So all MSH are creating in the hypothalamus. Okay, I think that this session is it's enough for this session. I would like to thank you for being very patient and hear this session. And if you have any question, I'm very eager to answer your questions. Thank you.